or is it going to human rights thing and about rights, particularly with Indonesia in particular? And, you know, and you can call me directly.
We were already off track for the 2020 targets, but COVID-19 is threatening to blow us completely off course. Therefore, we must take note and ensure that countries that have a high burden of HIV and are facing COVID are able to fight on both fronts at the same time. So in many countries, the people who have been delivering services for HIV are being taken over to fight COVID. That is a loss. So that's one way. So we're trying to say, look, find creative ways to keep people working on both. Then secondly, there are disruptions because of lockdown measures. Borders are closing. Public transportation is curtailed. So commodities are not moving easily from one place to another. Supply chains are disrupted. Third, manufacturing is disrupted. Many commodities, whether for prevention like PrEP, like condoms, or treatments, ARVs, are imported in many countries that are poor.
And are we just looking at the glass as half empty instead of half? Sorry, the Afghan war is the fight against.
And we are getting reports that are quite disturbing. For example, we get reports about like 30% closures of services in some places. That's significant. We're getting reports of stockouts of medicines. In some countries, we have had to organize and help facilitate ARVs being brought in from another country into another country to fill up where there are stockouts. We are getting reports of people being unable to go to collect their ARVs, and in many countries we have to step in to try to help them. That it is a battle. Then, more importantly,
it's clear from the numbers that cases are going down, but
with this corona, which has hit every country in the world, you see it's a new situation. Every country, rich and poor, is affected. Look at the billions that have been marshaled, first to give to companies to try to go in a race to find us a vaccine. Billions, just from the Europeans and Gates Foundation, and a lot of money here. And that is just for the treatment. What about the trillions that have been put down to keep people alive, to pay their rents and buy food, and because they are out of work? Trillions. So if the world can marshal resources of that kind, we can solve the problem of AIDS. Like I've said, it's not even just a financial issue. Some of it is about human rights. Some of it is about just treating people equally, tackling inequalities. That was about people's cultures and religions. And it's a problem we can solve. We need to put people's lives at par. Then we will have the resources and the means and we need the political will. We can end AIDS.